Hello, everyone. My name is Dr. David Ajibade, and welcome to Your Health in Your Hands. If you've been with us over the past several weeks, you know we've been talking about cardiovascular disease, and especially in Nigerian environment, and what you need to know and be able to do to take control of your health. This week, we're going to be talking about something different. Actually, we're going to be talking about the brain and neurodevelopmental disorders. And we're going to start with no other than autism. That may seem like, to those of you who are not used to it or not experienced it, it may seem like a very rare condition. I remember when I was a medical student over close to 25 years ago. It's amazing how time flies. And we had a class on the brain, on neurology, pediatric neurology, and brain disorders in children. And they were describing autism, and they were describing some of the conditions. I've got to tell you, I don't remember anything from that class except one thing. In fact, I just thought it was basically a white person's disease, and so I didn't really pay attention to it. And the main thing I remember from that class was that it is an autoimmune. It means that the immune system is attacking the body, which is not supposed to do. The immune system is supposed to protect you. But when the immune system is attacking the body, specifically in the gut, the digestive system, that's all I remembered from our class on autism. And so, like I said, I never thought it was going to be something I would treat. I never thought we would be dealing with it to the extent that we're dealing with it today, because I thought it was a white person's disease. But lo and behold, these next 20 or so years, it has become a worldwide phenomenon. As a matter of fact, in the U.S., it is down to more than 1 in 60 children in the U.S. are born with some form of autism or the other. So it's becoming a big problem. We don't have the statistics. It's probably not going to be as bad in Nigeria as in the US, and I'll probably explain to you some of the reasons why that is so. But it's becoming a big problem here. When I was in medical school and when I was in Nigeria before I left for a few years, there was nothing like a school for special needs. There was nothing like we never had all these trainers or therapists or speech therapists for special needs. It was unheard of. People just maybe they were then, but nowhere close to the numbers that we have today. So it's becoming a huge problem. So I felt that with this first segment, or with this first day, let's talk about autism in particular, and maybe some of the things that we can share might be of use to you, especially if you're a parent and you have a child that is dealing with the condition. So essentially, autism is a neurodevelopmental disorder, and it affects quite a few people. There are 3 cardinal signs of autism. One is it has communication problems, so your speech, especially your speech. Many children are not able to speak. They call them nonverbal. Some are able to speak, but only a few words. The second one is your social interactions. Children tend not to be able to, if you're on the spectrum, and it's a very wide spectrum, by the way, going from being able to speak to not being able to speak a single word. And then from social interaction, being able to communicate and have friends and play with friends, to being completely isolated, being on your own. And the third aspect is what we would term odd behaviors. So the child tends to like to spin around and around in circles, or they just like looking at things that spin, or they like just like water pouring down. And it's like, what is going on here? So those are the 3 cardinal signs with children with autism. At first blush, they don't look like they have any issue, but when you begin to sit down and spend some time with them, those traits begin to arise. And for some parents, they can be extremely distressing. I visited a family one day, and their son, I think was 6 or 7 years old, and this kid, from sitting down quietly, would just get up and just basically tear things up, bang the doors, break the TV, put out lights, and just make a mess of everything. And you could see, and my heart went out to his father, because I was with his father at that time, and you could just see the drain. He was just drained. He was depressed, he was unhappy because they had tried everything. They had gone to see the pediatricians, the neurologists, the psychiatrists. They had tried everything, and there were no good results. The other thing I would see would be kids from sitting down normally to just suddenly laughing without any excuse me, something was in my eye, without any provocation. They start laughing, or some would just start crying without any provocation. On over and over and over again, and it happened in different ways. And some behaviors were as bad as what is known as fecal smearing. The child poops, he looks at his poop, he puts his finger in his poop and rubs it on the wall. I'm sorry, I know this is TV, but I gotta tell you as it is. Fecal smearing was a big thing. Many of them were not toilet trained. Most of them aren't able to really pay attention in class. They're not able to hold their pens and write anything down. Many of them can't even brush their teeth. They can't even change their clothes. I have a patient who is 12 years of age, and he can't do any of those things. So it is a problem. It is a growing issue, and there are no protocols. From what I've seen, there are no clear-cut protocols by the pediatricians available to the pediatricians to say this is how to treat a kid with autism. Most times that's just pushed over to the behavioral analysts. These are the therapists who can sit down with the child and try to engage the child, try and get the child to speak. But it is not that, to me, that's cost intensive, is labor intensive, because you have to have a child, you have to have like 2-3 hours a day with the child every single day, every week, and for years. You may need someone to actually stay with the child and behave and help adjust the child's speech and adjust the child's behavior. Well, if you're a millionaire or a billionaire and you have a child like that, then you can afford to provide such therapists. But if you're the man on the street and you have a child like that, you're on your own pretty much, because again, there's no like medication unless the child is having seizures. And some of these kids with autism, they say about a third of them might have some kind of seizure or the other. They tend to have, so in such cases, they can give them medication to suppress the seizures. But in terms of getting that kid to speak and act normally and be involved in school, there aren't really any that I know of. There aren't really things that can be done for that in that regard. All right, so in the next segment, we're going to be talking about why, or what are the internal biochemical, physiological conditions that drive autism and make autism what it is. So if you stay tuned, we will be right back and we will get right into it. See you soon. Welcome back. We're talking about autism, one of the neurodevelopmental disorders, and we're going to delve a little bit deeper into some of the things that cause autism and how we can address it. And one of the goals that we have is that the problem with Nigeria is that we don't have enough. One of the problems, one of the many problems, we don't have enough therapists, we don't have enough doctors to go around. So one of our goals is to see what is safe and what can be used remotely. And that's, again, you need to be able to know what to do and how to avail yourself of solutions. Even if you're in Kafanchan, or Kafanchan is not far, very far away from here. You know what I'm talking about. I mean, the most removed parts of Nigeria. What can be done to take care of yourself, take care of your health, take care of your child's health? In this case, if your child has autism, what can be done? And so what we mentioned in the last segment was that the brain of the child is literally under siege. There are all kinds of things that are bombarding his brain. As a matter of fact, when I look at these conditions, I look at these children, I'm amazed at how well they are behaving when you consider all what they're having to face on a daily basis. So, like I said in the last segment, we started looking at heavy metals. We know that there's some relationship between the brain of children with autism and heavy metal toxicity. As a matter of fact, some research that they've done, they show that in areas where there's heavy mining activity, where they are trying to drill for metals in the ground, for instance, they find out that in those areas you find higher levels, even in Nigeria as well as in the US and other parts of the world, that in those areas you find higher incidences of children being born with autism-like conditions. So kids that may not be able to speak, may have deformities, they may not be able to function like they should. And so we began to address heavy metals, and we got results to some degree. But as you can see, heavy metals are just one part of the equation. There are several other things. And so after failing and after using and working on it for quite a while and not really getting the results, I began to travel. I went to the US, went to conferences. I went to see, okay, what is the problem, the solution? I have to say that many of the conferences, I really didn't find the answers. For even the biggest conferences where they were doing research, and I was very, very disappointed. But again, the answers began to come from some unexpected sources, and began to piece these things together into a jigsaw puzzle and really say, okay, what works and what doesn't work. General Patton, one of the great soldiers of World War II, his 3 cardinal rules for warfare were speed, simplicity, and boldness. So speed, simplicity, and boldness. So you can imagine why he had to be bold, because they were attacking the Germans and they were trying to win. He's one of the few people in history who never lost a battle. Anyway, so I want to lift a page from his book, and I want to say that when it comes to autism, and when it comes to any disease for that matter, our goal and our watchwords in the Brain and Body Foundation are speed, simplicity, and safety. Because we're dealing with kids, and anyway, it doesn't matter who you're dealing with. You have to be safe. You have to use a safe mode. So speed, simplicity, and safety. Speed, because we want to get the answers quickly. If it's not working fast enough, we change. And so in this regard, when we saw that we were not getting the answers fast enough, we began to, like I said, we began to look for other solutions. One of the key things that have given us the most results has been the discovery, well, not our discovery, but discovery before by other people, that a lot of what goes on in the brain is affected by what goes on in the guts. And you can see these red lines showing the influence. And especially what goes on in the gut. So this is a diagram. If you haven't noticed, this is a diagram of the stomach and the digestive system. So what we found out was that children with autism, and maybe some of you parents have noticed this, that they have digestive issues. Not mentioned in the top 3 signs of children with autism, but most children with autism have some degree of constipation and, in other cases, diarrhea, or sometimes a combination. So they have those symptoms going on. So what was causing those things? What we now know is that there are microorganisms in the gut that influence to a very large extent what goes on in the brain. And this is not just about children now, but adults as well. Your moods, your appetite, your food preferences, even sex can be influenced by what's going on in the gut. I know that sounds hard to believe, but it's very, 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 very true. Again, if you do some research on your own, you will find that out. So it's not just about the bacteria. We have viruses. As a matter of fact, some people in the US, some researchers focus on treating viruses alone. Other people focus on treating yeast infections alone. Infections, so like candidiasis. All of these, in many cases, are at work in the guts. And so we see that in children, that they seem to have a preponderance, an excess of these what we call bad bugs. And they are influencing what is going on in the brain. And so if I were to ask you, what would be your approach to this? I know you're not a doctor, but what would be your approach? Having established the fact that the behavior of your child is driven by what's going on in his belly or his or her belly, what would be your approach? We found out that the best way, the best start, was to find a way to safely, there's our word again, safely, push out or remove the bad stuff, so the child eventually excretes that. That was what we now found out. So for the first 1 or 2 months, the goal is to slowly remove that out, and there's a safe way to do it. Of course, we can't share that on TV because it's a specific way to do it. But you can find out from your doctors and from other physicians in the field. You can slowly remove that. Once that is done, and ideally, you should have 85% good bacteria. Everybody has bacteria, so there are some good bacteria that are helpful. There are some bad bacteria that are obviously not healthy. The goal is to reestablish this right ratio. So 85 good, 15% bad. If you were to compare a child with autism's guts to a child, what is known as a normal typical child's belly, you will find a clear-cut difference. You'll see that one is clearly not healthy and the other one is more healthy. So the goal is to try and push the healthy child's guts, the child with autism's gut health, and make it as close or approximate the normal child's gut as much as possible. This is really the first step and the most beneficial step to setting the child on the right path towards health and normal function. In the next segment, we're going to continue with this and give you a few more tips and instructions. We'll be right back. Welcome back. If you're just joining us, we are talking about autism in the series Your Health in Your Hands. So we kind of established that the first thing you want to do is to try and get the stuff out of your gut. Now, you don't go crazy on me, because it's not just a question of just flushing your child's insides, because the healthy bacteria have to be there as well. So you don't want to just get rid of everything. And so there are certain supplements, there are certain approaches that can help to reestablish the what is known as the gut flora, the gut environment. So you need things like enzymes, probiotics, and other things that can help to reestablish a good, healthy gut environment. Some children simply lack the enzymes to digest food particles. And so sometimes that food particles can get into blood. Those undigested food particles can actually get into the bloodstream and actually go to the brain. Now, there's supposed to be a barrier here, but this barrier doesn't always work. It's called the blood-brain barrier, BBB. But from what we've seen, there can be a lot of the continual damage as a result of all these chemicals and these bugs. By the way, bugs and viruses and bacteria also secrete some really bad toxins, so they can get into the blood and actually affect the brain. The BBB doesn't work as well. So once we've established that, the next step is also to heal the guts. So there might be produce anti-inflammatories to heal the walls of the gut so that they're not leaking. There's a term called leaky guts. Again, there are certain things we can do to help to improve and close up those holes and enable it to get back. Now, back to the brain. Once we've kind of like plugged this, again, this doesn't happen within a day or two. It could happen over a period of time, like 1 or 2 months. Once you've stopped these bad stuff from going up, the next thing that you can do, there are things that can help to remove heavy metals. There are things that can help to remove chemicals. And of course, the immune system. There's what is known as neuroinflammation. If you followed our last talks, you remember we talked about inflammation can happen to the arteries and to the blood vessels. Well, inflammation can also happen to the brain. The brain doesn't have any pain receptors, but it certainly can be affected by neuroinflammation, which is really caused by the immune system. Remember, I talked about it earlier, that in my class on autism when I was a medical student, the main thing we were told was that autism is an autoimmune disorder. That in autism, the immune cells are attacking the body, especially attacking the gut and the brain. there are special agents that can also help to reduce the attack by this immune system and actually basically rein the immune system in so that it doesn't attack itself like it was doing before. Now, in some cases, the child may have seizures, and once those are diagnosed, the doctor, especially if you notice it's like, for instance, those seizures may not be this wild, aggressive seizures where the child is thrown on the floor and is foaming out of the mouth. They could just be subtle signs, like child will just go blank. Maybe he may be walking around or sitting down and just goes blank, just stares into space for a few minutes. That could be a seizure. So when you notice these things, be sure to go see the doctor because there are medications that can actually address seizures. So again, you've got to be patient. This doesn't happen all of a sudden. These are just some of the things that we found out that can help kids who are dealing with these major issues. Once you get rid of the parasites and the worms and the viruses that are causing this problem, you will be shocked at how quickly these children begin to behave. Like some of the things that I get back from parents is that, well, for the first time ever, he's sitting down through an entire class, or they go to church and the child is sitting down through the church service. Before, the child was all over the place, running up and down, da, 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 da. Other times, the child is like one of the things they say is that the child is like he's coming out of a fog. For instance, he's just understanding what we're saying to him for the first time. We don't have to say the same thing over and over again to him. He's like he understands what we say when we say it once. Other children are always banging their heads against the walls. You find out that you remove this stuff, you don't see that head banging anymore. Fecal smearing. Some kids are not able to control their bladder. They just pee on themselves or they poop on themselves. You find that some of these things can actually be controlled and constrained once you begin to do the right thing and help these kids with autism. So those are just a few tips. I hope I haven't thrown too much at you. This was just one show, but if you have any questions on that, let us know. Send in your comments and all that, and we will hopefully address each of them and get back with you. So again, thanks for joining us. This is Your Health in Your Hands, and I'm Dr. David Ajibade with the Brain and Body Foundation. Thank you.